Not everybody knows. Do you know what your deductible is, what your coinsurance rate is if you have regular Medicare? Normally, the Medicare annual deductible goes up every single year. And what that means is that if you have traditional only, you have to pay that amount, I believe it's $200 and something first every year before Medicare will then pick up and pay the 80%. Medicare is considered what they call an indemnity plan, meaning it pays on an 80%, 20% basis. However, that is not 20% of the provider's billed rate. They don't bill your insurance the amount that they're going to get reimbursed. What they bill is called the billed rate. What they get paid is called a contracted rate. The difference between those two amounts, if it is a Medicare provider, gets adjusted off and you are not responsible to pay that. So you're only responsible to pay 20% of what the provider is paid. And a lot of people don't know that. So what we do at Understood Care, we compare a bill you may get with your explanation of benefits or the things you get from your insurance company that say this is not a bill. We compare the two. Then we take over, we call the doctor's office, we explain why you don't owe that amount, and then make sure that it's adjusted off so no further action is taken. For Medicare Advantage plans, a lot of times you have a copay, which is a set amount. Like if you go to your primary care, it could be $0. It could be $10. It could be $20. Now, a lot of these plans also have a deductible and a coinsurance amount for services outside of a physician's office. What we do, we call or we go onto your insurance's online portal and we look up your benefits for whatever service you're interested in, and then we break it down for you into a language that's easily understandable so that the next time you have to go get a test done or go to your doctor's office, you know exactly what your coverage is, so you're not going to come across any surprises when you're at that facility. We help break down your benefits and make sure that you're receiving what you're supposed to based on your coverage, but also that you're not getting billed or paying for something you're not supposed to.